at a practice level, it's interesting. You see this wide variety of patients who come at too early, who come at appropriate times, who come too late, and we deal with all of them and all their different needs as they go forward. But in general, there's probably three big misconceptions out there in the world that people travel with who are not yet introduced to the issues around vein therapy. And the first is that a lot of people in the second half of life, and I call vein disease really one of the high mileage diseases of the second half of life. And so the first misconception they have is they're feeling tired, with heavy, tired, achy legs and all the symptoms we know about, swollen ankles, cramps, etc. And they make the wrong determination that they're just getting old and there's nothing they can do about it. And so they put up with it, and they put up with it for probably much longer than they should, until they either see a commercial, read an ad, or a friend urges them to come and get evaluated. And sometimes that evaluation is too much for them to come and get a full evaluation, so we also offer a 10-minute free screening in the office for people who are unsure. And so the ones who come in who are unsure, they get their little 10-minute free screening, and half of those patients really don't have venous disease and they don't need anything done. But the other half were right, they did have venous disease, and so they need to come back, get a full evaluation, and then move through the system. So that's the first misconception, that they have these issues and they don't think there's anything they can do about them. We go ahead and treat them and they feel fabulous afterwards, and they go, wow, I never realized that. Right. The second thing is, of course, they say, well, I talked to my grandmother and my mother, and they had this vein stripping, and it was horrible. It had involved a trip to the operating room, an anesthetic, a lot of incisions, and a long recovery. And of course, the second misconception is they don't realize that it's completely different now. And in the last 20 years, we've completely changed how we do this. It's moved from the hospital to the office. It's moved from a general anesthetic to no anesthetic. And it's moved from a 1-month recovery at home to a bandage and you drive away and even possibly go back to work that same day. So again, a huge paradigm shift in how we're addressing a very age-old problem, which for 100 years we did with vein stripping, and a tremendous inconvenience for the patient and discomfort, to something now which is a straightforward office-based procedure. So that's the second misconception. And so they really just don't understand that, and once they come to realize that, they're overjoyed. And then the final thing is, they look at the vein thing as having spider veins plus the stuff down below, and they think this is all lumped into a cosmetic procedure with no insurance coverage. And so the third big misconception is that in fact 98-99% of what we do in the office is fully covered by conventional insurance. And a large majority of the population doesn't realize this. And so even when they think they need care, they hold off getting care because they really don't want to incur the expense. And in reality, they have a copay, they may have a deductible, but the majority of what the cost involved is covered by their insurance.